Welcome to Health Matters. I'm your host, Dr. Lana Marconi. On today's show, we're going to explore strategies to good health, beginning with pregnancy and fertility, and then shifting into positive relationship habits, and then what groceries you need in your cart and how to cultivate your energy Qigong style. Kindly welcome my first guest. She is a 2014 naturopathic doctor candidate, and she also has experience in clinical nutrition, and she is a registered holistic nutritionist, Erica Robinson.
Thanks so much for having me, Lana.
Thank you for being here, Erica. So we're going to talk pregnancy.
Yes.
You know, a lot of emotions wrapped up in pregnancy for women, from fear to worry, concern, even joy and excitement. How can a naturopathic doctor help a woman who is pregnant, who wants to be pregnant? Let's start somewhere.
Yes. Well, fertility is probably the first step.
Okay.
Now we're seeing more and more women put career first, and then they want to have babies later in life, which we know is a factor for infertility. But there are so many things we can do naturopathically to increase a woman's chances of getting pregnant, and the men as well, because men do contribute 40 to 50% of infertility cases. So naturopaths help with hormonal imbalance regulation. So in a lot of cases I see women with endometriosis or fibroids. So they simply can't get pregnant because there's a structural issue caused by high estrogen.
Right. Or polycystic ovarian syndrome.
Especially PCOS. So that's where the woman is not ovulating regularly because they have high insulin levels, which is related to carbohydrate intake. So you can tell from that alone, like, we can already make a lot of changes through diet. Other things like acupuncture, for instance, if we do acupuncture, increases fertility rates up to 65%, studies have shown. And then just a general health program, such as cutting out smoking, eating right, exercising, increases your chances 42%. So
what about detox? Because a woman's body carries, you know, a lot of
Yes.
toxins that the baby, you know, I mean, so what do you, is there a detox program?
Yes, well actually, so in an ideal world, I recommend women start seeing me 1 year before they intend to get pregnant.
Okay.
3 months is still a good time frame.
So you're preparing the body.
Exactly, we want the ideal environment because we know that the environment of the mother's body will actually affect up to the grandchildren's genetic expression. So we do work on detoxing. That's a huge component of it. You're so right. The other thing is, if they plan to breastfeed, you're going to be downloading toxins into your baby through the milk because toxins are stored in fat, which there's a lot of in milk. So we do like to cleanse the body before we think about getting pregnant.
What about like underlying causes, for example, gluten intolerance? Now that doesn't necessarily create infertility, but it sets the condition up in the stomach for inflammation in the stomach, like in the small intestines, really inability to absorb nutrients that are needed for like the sperm and hormone production. So what do you do with that?
With stuff like gluten sensitivity? Well, and that's a good point, because it's not just celiac. You can have a general sensitivity and not be getting pregnant for that reason. And it's just what you said, which is inflammation. So there's a lot of strategies we use to cut inflammation. Some of those can be botanical, like the turmeric or curcumin, which is a herb. Other strategies is cutting back on carbohydrates and simple sugars. Having a lot of good fat in your diet, like coconut oil, fish oil, cod liver oil, those are anti-inflammatory. So we have a lot of strategies to really help with that front.
Nice. Okay, what did you bring? Because you brought some goodies here.
Yes, I brought some pregnancy-safe botanicals to show you, because a lot of people don't realize that there are safe herbs you can use. There's now a program called Mother Risk that you can call if you are interested in knowing if your supplements are still safe during pregnancy. So I wanted to show some of those today. One of my favorite things is echinacea, so that's at the front here. And now that's an immune boosting herb. So in case you are getting sick, that's a good herb that you can take to really rev up your immune system.
Is that prior to pregnancy and even throughout?
Throughout the whole thing. There are very few immune herbs you can take during pregnancy, and this would probably be my top go-to for that.
Right, just like acupuncture, there's certain points that you don't want to press, or you're going to deliver a baby.
Exactly,
right?
Which is good if you're past date, but not so good if you're, you know, far away from that.
Okay, what else did we bring?
So I've got nettles tea here. So nettles is this beautiful nutritive herb. We use this for fertility, and in one case, that's all we gave the patient, and she got pregnant. In her instance, she was low in iron, and that makes your thyroid become hypothyroid, and that can prevent pregnancy. So I think that's how it helped. But nettles tea is great throughout all of pregnancy, and especially in the postpartum period.
And, oh, what's over here?
Oh, okay. Or maybe I'll show you the last herb before I transition to these two. This is a really lovely nursing tea. So when you want to increase milk production, a lot of us have low milk production due to stress.
Yeah.
You can use herbs in this blend, such as fenugreek, blessed thistle, goat's root.
Yeah. And there's also acupuncture points for that too.
Yeah. Oh yeah, there's so many things we can do, which is really lovely. And then assessing latch too, because a lot of times baby's just not latching well and then the milk is not flowing.
Yeah.
So I've got the tea, and then these two things here are really good for digestion and the respiratory tract. So in the front I have, it's called slippery elm bark, and slippery elm is really good for heartburn, which a lot of women get in the 3rd trimester.
Can you hold it up for us?
Yeah, so that's the slippery elm. So you just mix this into water or juice or applesauce or porridge, and it really does help to combat any kind of gastrointestinal issues. Because with pregnancy, we really want to minimize what kind of medications you're taking, over-the-counter ones included. So these are nice, safe alternatives to antacids. And then the other one I have is marshmallow root. So marshmallow root is great for urinary tract infections, which we want to nip in the bud with pregnancy because they can lead to preterm birth. And it's also good for cough and any kind of lung issues because it basically helps the lung produce more healthy mucus. So that's the marshmallow root. And then I also have these things here. These are dried fruits you might recognize. There's prunes, dates, and figs. These are amazing because in pregnancy, women do often get constipated due to high progesterone levels. And these things are all known to speed up what we call transit time, or how long it takes to go to the bathroom. We really don't want constipation during pregnancy because it can lead to pelvic floor problems just due to all that pressure in the pelvis. So we want to keep things flowing.
So do you recommend women eat this daily?
Daily, definitely. If they're having issues, I would eat these kinds of fruits daily. You can actually get a syrup made out of figs that's really effective at getting the bowels to flow.
What about caffeine?
Caffeine, so studies show there's no safe amount of caffeine. That said, we have, people in Europe still drink coffee all throughout pregnancy, and your midwife or OB will say that 1 to 2 cups is okay, but we don't have documentation stating that any amount of caffeine is safe. Yeah.
As a naturopathic doctor, do you promote a midwife or going to the hospital?
It certainly depends on the person's preference. So my role is really to educate them on the differences between the two providers and also to identify if it's a high risk birth to begin with. So 95% of births are low risk normal pregnancies, which can be eligible for midwife. But if you have diabetes, if you've had a previous C-section, if you have twins, those are some conditions where we would need to work with an OB for sure.
Yeah, and if a person is on a lot of medication, let's say they're depressed, what do you do with that? Because that would inhibit their body.
It does. It does. Well, there are things we can look at transitioning to them over time that are natural, that wouldn't be have the same contraindications with pregnancy the way that antidepressants might. With medication in general, naturopaths are really effective at helping you decrease how much meds you're on, so that can increase your likelihood of getting pregnant too and be safer.
Yeah. So now, who has a jurisdiction in terms of authority for that? Is it the naturopathic doctor or the medical doctor, or do you work hand in hand? Is it a collaborative?
It should definitely be collaborative. Yeah, it's always better to be collaborative, and we actively write and fax your medical doctor to say, this is my thought, this is my plan, this is the research behind what I'm recommending. And they're very receptive to it, I find.
Nice. What else do we have?
So we have really good fats, which I brought at the end. So we've got stuff like coconut oil, which is really antimicrobial. It's good for your immune system. But the whole basis with fats is you want to be anti-inflammatory during your pregnancy and fertility, because you're more likely to get pregnant. But also it helps to lubricate the tissues. It helps to make the skin stronger, so you avoid stuff like tearing during birth, maintaining the integrity of the pelvic floor. And then it keeps your blood sugar nice and stable, which is really important during pregnancy. So,
and often people just rub it on their skin.
Exactly.
And in their hair.
And it prevents stretch marks too. So stretch marks are multifactorial.
I know parents who use it on their babies.
Yeah. Oh, it's so safe. It's so gentle. You can use it all over, especially after a bath, just to seal in the moisture. And even on nipples too. When you start to breastfeed, a lot of women have some discomfort.
So it's a soothing effect.
Soothing, antimicrobial. So it's a really good all-around fat. I did also bring olive oil for the same reason. You can put this in smoothies, oatmeal, on your salads, and that's great for healthy skin. And hemp seeds, which have fiber and omega-3s in them, so those are great.
Very nice, good in your smoothies.
Oh,
good on
so
cereal.
good.
Just
yeah,
good to
porridge.
eat in general.
Exactly.
Yeah, nice, very nice. What do you do for emotional, mental stress?
For support?
Yeah.
There's a lot we do. Like, certainly the backbone of my practice tends to be that psychological counseling aspect. And NDs are qualified to counsel people through normal life changes such as pregnancy. The center that I work at fortunately also has a variety of counselors and psychologists available if we do need extra support, so that's really nice. And I do recommend something like a yoga class because you can bond with other moms at that point and get that community-based support, which is really nice.
What about post-pregnancy, a colic baby?
Colic?
Yeah.
Well, this tea that I brought actually is great for that because it does pass through the mother's milk. There are other things we can do if it's a newborn baby and we don't want to give it any kind of botanical yet. Homeopathics are really nice for that. The other thing is probiotics, which we do recommend starting from birth and onwards. That helps with colic. Eliminating foods from mom's diet that could be offending the baby. We don't have any scientific research showing that, but we have clinical data showing stuff like broccoli can cause colic, as well as rubbing castor oil on the belly, if you've ever heard of that.
Yeah, I have
that
heard of
helps everything.
Yeah, yeah. When the mother is at that moment to deliver and she's in tremendous pain, I heard that arnica
It's amazing.
is supposed to calm the person down. Does it really?
It does. I used
it?
homeopathics for my birth, and I swear by it. You know what? I was not a believer yet until I tried them during labor. And I can't speak highly enough of them. And so a naturopathic doctor can work with you to build a labor kit, because it's not just arnica. There's about 12 that we would use given different parameters during labor. And it certainly helps you just get through that next contraction.
So did you have your baby au naturel?
I did.
Wow.
I did. Yes.
Wow.
At home birth, which is not for everyone, I understand.
In the
but,
water, or?
I did labor in the water, but then I had her not in the water. So. Yeah,
Wow,
but there are many methods of pain relief, such as water birth.
Yeah, so you practice what you preach.
I do.
So you're a very good naturopathic doctor.
You know, I do. I slip up here and there. I'm only human, but yeah, I try. Totally.
What are some tips that you can give moms who want to be pregnant?
Who want to be pregnant?
Yeah.
Honestly, eating healthy and moving are the two biggest things.
Exercise?
But exercise is so critical. Just get blood flow through the pelvis. And usually that's what it is. It's a stagnation of blood in the pelvis, just not moving. So stuff like osteopathy and chiropractic, acupuncture,
nice.
Those all help. Yeah. The other thing is, if you're not getting pregnant within 6 to 12 months, see a doctor to get your hormones evaluated, because they can be addressed and fixed.
Nice. Erica Robinson, thank you very much for joining us here tonight on Health Matters and bringing all your goodies. We'll be back more on Health Matters and some more strategies to good health and wellness. Come on back. Every day, your heart beats about 100,000 times, sending 2,000 gallons of blood surging through your body. In order to make sure your heart is in tip-top shape, eat healthy, well-balanced meals and don't skimp on the exercise.